Hi, my name is Xiaohan. I'm a PhD student from Virginia Tech. I will be presenting our research work leveraging prompt-based large language models, predicting pandemic health decisions and outcomes through social media and language. During COVID-19 pandemic, social media was at the center of proliferating antipathy and distrust towards government health policy and recommendations. Millions took social media to oppose federal and state health practice, criticize medical professionals, or organize some anti-vaccine and mask-wearing rallies. So the misinformation on social media obscured people's knowledge of safe health practice, making well-informed decisions difficult. Using evidence-based theories like fuzzy traces theory allows us to create a psychologically descriptive model that transforms language into analyzable unit so to predict human behavior. So in our study, we leverage the prompt-based large language model to delve into nuanced language patterns in social media discussion, opposing COVID-19 public health practice through a theory-driven approach using fuzzy traces theory. So in our study one, we first collected data from 20 well-known subreddits that were banned for denouncing pandemic health practice from May 2020 to October 2021. We also collected temporal corresponding health outcome data in the United States. For example, daily number of COVID vaccine administered, daily generated and ICU hospitalization counts due to COVID-19, and so on. The first step, we developed a multi-step prompting framework called role-based incremental coaching, which is RBRC, to predict the gist across social media discourse. The first part of RBRC focuses on enhancing the model's understanding of its role as a task-performing agent. And in our case, the task is to extract gist from Reddit conversation. So first, we prompt the model, your role is to understand cause-effect relations in social media posts. Can you define cause-effect relation? We get the model response like, certainly, a cause-effect relation is etc. etc. Next, we ask, based on your role, can you explain the term gist in relation to sentences that have causal coherences? And also we get the corresponding model response. So why are we doing this? We do this because asking large language model to generate some potential useful information about a given task improve the final response. For example, when prompted with the following question, which country is larger, Congo or South Africa? GB3 answer incorrectly. South Africa is not right answer here. However, when the model first prompted to generate some knowledge about the size of Congo and South Africa, the model used this answer to generate the correct answer response to the same question, which is Congo. So based on this intuition, the corresponding response to P1 and P2, which are output O1 and O2, are then integrated with a task-specific prompt in the following step. And in this stage, which we call it as incremental coaching, we break down the final task of generating a gist into some small subtasks. In prompt 3, given the text, I took vaccine yesterday, I really sick now, we ask the model if there is a cause effect implied in this text. We get the answer yes or no if the model enter yes. RBRC prompt model to extract the corresponding cause and effect text span. And using this text span, RBRC prompt model to generate a coherent gist. And finally, we get the final response. So using this framework, we're doing three things simultaneously: classification, extraction, and generation, which would normally require three separate models for each task. To evaluate RBRC, we're using human evaluation based on the following criteria: accuracy for classification, relevance for extraction, conciseness for generation. RBRC performance across the three criteria were generally high based on the inter-rater agreement score using FlexiCappa. So here are some sample results from applying RBRC on Reddit posts discussing pandemic health practice. So this is the Reddit post. This is a sample cause effect we extract by RBRC framework. And finally, that is the gist. After extracting all the gist from our data, we want to know what kind of gist characterize people's argument against pandemic health practice. To find out, we first use SentenceBird to generate the sentence embedding from our gist, and k-means to cluster the embeddings. And this gives us a total of 6 topical gist cluster that characterize how people argue against pandemic health practice on banned subreddits, which are vaccine, mask wearing, the impact of lockdown, the pandemic micro impact on society, conspiracy theories, and finally, no gist that is post without gist. So here are some representative examples of RBRC extract gist from each topic cluster. For example, the implementation of vaccine mandate has resulted in people losing their jobs. And here are more examples. And what's really interesting is that when we map the daily volume of gist cluster, we see that the peak value of gist for each cluster align closely with key event related to respective topic embodied by those cluster. For example, by May 2020, 54% of the world population was under lockdown, coinciding with the peak of cluster 3 gist, which related to the impact of lockdown. And here are more examples. Given these results, we want to address the question of whether and how social media language in form of gist could significantly influence online engagement behavior and predict patterns in nationwide health outcome in United States. To answer these two research questions, we apply the method called Grange causality to 33 and 34. Grange causality is a statistical test to determine whether a time series X is meaningful in forecasting another time series Y. So for study 3, we have two hypotheses, which are the daily frequency of gist significantly Grange cause the online social behavior, which including upvote ratio and the number of comments. For 34, our hypothesis is the daily frequency of gist significant greater cause people's health decisions and national health outcomes. And for both study 3 and study 4, we have the reversal wording for those hypotheses. In study 3, our findings show that gist on social media can significantly predict the online engagement behavior. For example, the daily volume of gist significantly predict upvoting and comment behavior across the topic of mask wearing practice. We also found the online engagement behavior also can significantly predict some of the gist on social media. For example, the upvote and comment behavior can significantly forecast the fluctuation in the volume of lockdown related to gist. For study 4, our findings were across three things. Firstly, causal talk around mask wearing practice significantly predict the nationwide fluctuation in total and new daily COVID-19 cases. Secondly, recent trend in daily COVID-19 cases prompts causal talk on the pandemic macro impact on society. And finally, causal talk around the vaccine and the national COVID-19 vaccine trend are bidirectional. In summary, by introducing and applying RBRC in the analysis of social media conversations, we demonstrate the effectiveness of prompt-based large language model in identifying nuanced linguistic patterns, and we expand the potential application of a prompt-based language model for theory-driven textual analysis in HCI research. Secondly, By leveraging nuanced insight from gist across different house topics, content moderation can become more effective in identify and manage discussion that may contribute to the spread of online house misinformation. Finally, integrating RBRC-powered gist detection and real-time analysis of national health indicators into these tools can potentially enhance the public health agency's ability to understand and respond to critical health challenges in relation to people's online behavior. To summarize our work, we built a large language model-based prompting framework to identify psychologically influential mental representations from social media posts, demonstrate the link between this gist and a public health event. Finally, we verified associated with the user's engagement and national health trends with the implication for HCI design and the promotion for public health. For the future work, we try to expand our dataset to include more general-ready data in order to explore diverse viewpoints and a nuanced discussion around HCI and public health. Thank you so much for listening. For more detail about the methodology and discussion, please read our paper.